Surgeon General says reducing stress and burnout among caregivers is now a public health priority. Here to talk more about this is Dr. Alice Connors-Kellgren, a clinical psychologist at Tufts Medical Center. Nice to see you, doctor.
Hey, doctor. Parenting is the most important job in the world, and there's no manual, or you can't go to an app and learn everything instantly. It's enormous responsibility, but it's always been that way. I'm not splitting the atom here. You've heard that before. So what does the nation's top doctor think is different now?
So part of the reason that this is getting attention now is because we know much more about the negative impacts of stress on mental health, families, and communities. But part is also because parenting has changed significantly over time. Many of the systemic issues that affect all of us, such as financial strains, economic instability, increasing loneliness, the complications of social media, have a huge impact on parenting. Parents' demands have increased quite a bit. Children spend a lot more time doing structured, supervised activities now than they did even just a generation ago, which require a lot more time and energy from parents, while the demands in other areas of life have also increased.
So do you agree that it's a public health issue?
Absolutely. A recent study by the American Psychological Association found that 33% of parents report high levels of stress, compared to only 20% of childless adults. So there's a significant disparity in the amount of stress that parents are experiencing. We also know that chronic stress can be harmful to the mental and physical health of parents, which in turn impacts the well-being of their children and can lead to an increased risk of depression, anxiety, and other mental health conditions.
So doctor, the U.S. Surgeon General says, that I'm quoting here, the American public needs to do more to support parents and caregivers. So without going through the full list, what's on the list?
Yeah, so Dr. Murthy is proposing a number of policy changes to reduce the stress on parents, including paid family leave and sick time policies, as well as greater financial assistance for daycare and universal preschool. He's also making suggestions for individual actions that we can all do to support the parents we know, such as checking up on them to reduce loneliness and isolation, stopping by to help out, maybe bringing a meal or giving them a break so that they can take care of themselves.
And what about employers, quickly, doctor?
Yeah, so there's a lot of opportunity for employers to support parents, such as flexible work schedules and paid sick time, as well as training for managers on stress management, and then providing access to comprehensive, affordable, and high-quality mental health care.
Excellent.
Dr. Alice, great to see you. Thank you.
Thank you
for your time.
Thank you.
Nice to see you. Thanks.